So missed one topic, that is the femoral hernia. Okay, so the femoral hernia, that means herniation of any abdominal contents through the femoral canal. Through the femoral canal, if the protrusion occurs, it is known as femoral hernia. Okay, and the femoral hernia you can identify clinically if the swelling is present inferolateral to the pubic tubercle. Inferolateral to the pubic tubercle, it is femoral hernia. And femoral hernia most commonly occurs in the female. F for female and F for femoral. So femoral hernia occurs more commonly in the female, and it occurs due to weakness of the abdominal muscles, most commonly in the female in the pregnancy state. And this is a very good picture of the femoral hernia. Look at that. This is pubic symphysis, this is pubic tubercle. We told that any swelling in the groin that is inferolateral, that means inferiorly and laterally, if there is any swelling, that must be femoral hernia. And remember one thing also, if there is any swelling that is located above and medial to the pubic tubercle, that must be inguinal hernia. So the femoral hernia is located below and lateral to the pubic tubercle, and inguinal hernia is located above and medial to the pubic tubercle. So if we compare with the inguinal hernia, it would be more easier to remember. So this is the difference between the inguinal hernia and femoral hernia. So inguinal occurs more in the male, femoral occurs in the female. Inguinal hernia occurs in the inguinal canal, and femoral hernia occurs through the femoral canal. And the most important differentiating factor or point which we use clinically more frequently, that is the site. The inguinal hernia is located above and medial to the pubic tubercle, but the femoral hernia is located below and lateral to the pubic tubercle. That's the difference. So you should never forget these two difference, that is the difference between inguinal and femoral hernia, and difference between the direct and indirect inguinal hernia. Okay, so that's all about the inguinal region and hernia. So I forgot to show you this nice picture about the femoral sheath and femoral canal. So femoral canal and femoral sheath you can see in this picture very clearly. Okay, it's not possible to. Okay, look at that. This whitish structure, whitish triangular structure, this is the femoral sheath, and it is covering up to, sorry, this is femoral triangle, and above there is femoral sheath. Look at that. Femoral sheath is a funnel shaped sheath. It is covers the femoral vessels. The red one is the femoral artery, the blue one is the femoral vein, and the green one, the most medial one, it contains some lymphatics. So the femoral canal is nothing but the medial portion of the femoral sheath. And look at that, in the medial part there is the bluish portion, that is the lymph node of cloaca. Okay, so the femoral sheath, it covers the femoral vessels up to upper 3.7 centimeter, and femoral canal is nothing but the medial content, medial tubule like structure of the femoral sheath. And this is a very good picture of the hernia. Look at that. This is loop of intestine. The pinkish one is the loop of intestine. It is herniating through the anterior abdominal wall through a weak point. So that's all about the hernia.